Hi Kerrie, thank you for agreeing to take part in the Respect Project's local community programme. I'm just going to ask you a few questions about your childhood, if that's
No
okay.
problem, yeah.
Where did you grow up and what was your childhood like?
Well, I'm from Monaghan, so I was born in the countryside and I lived there till I was 9 and I had a fantastic childhood. And then my parents made the decision to move into town and I hated every minute of it. I still to this day talk about our old house in the country. It was just, everything was perfect, your neighbours, great primary school. So I really didn't take too well to city living, I suppose, but they were making the decision for the right reasons, so it wasn't too bad really.
Yeah. What was your experience of school like?
I really enjoyed school. I was very lucky that when we did move house I was able to stay in the same primary school, so I had my same friends, and then whenever we went to secondary school a lot of the same friends came with me, so we had the same people all the time, so that was really good. I enjoyed the academic side of things. I enjoyed the sport. I tried to take part in as many teams as possible. The art, drama, if there was a play or anything like that, I'd take part in it, but I never got a singing role, so that definitely was not my strong point with singing. But I really enjoyed school, got on well, and it was really important that my friends were there for me. We had a great group of friends. We didn't get into trouble, there's no peer pressure for anything like that, there was no smoking or anything like that. So, and to this day, they're still really my best friends, so I was very lucky and I had a really good experience of school.
Yeah. What was your hobbies and interests as a child?
So I was really into sport. We started the first girls football team in a primary school. There was never a girls football team, and back in the 80s and the 90s it wasn't a thing, so we had the first girls football team, which was great, and I was the captain of that, so that was a really good moment for me. And then moving on to secondary school, there was lots of other teams as well. I always tried to take part in sport. Entered art competitions. Surprisingly I won prizes but I wouldn't have considered myself very artistic, even though I really enjoyed it. And just like hanging out with my friends and things like that. And so like whenever I was a teenager, you wouldn't, it was totally different to being a teenager now, so we were a bit more, I suppose, let loose and just go out for the morning, come back whenever it got dark and things like that, so playing on the street and all that. So we had just hanging out with my friends as well, which is good.
What is your favourite childhood memory?
So I suppose probably like being in the countryside, like I said, that was, I really loved growing up in the country, and my uncles would have had farms around us, so in the summertime, which always seemed to be so much sunnier and warmer than it is now, there would have been like making bales of hay, so you'd be out first thing in the morning and making hay bales, stacking them, driving the tractor, and when I think of it now, like you were 5 or 6 and you were like stuck up into a tractor and just drive away like crazy. You wouldn't do it now, you wouldn't put a child there in that position, and like they were putting us to work, but it seemed like fun. It wasn't work at all, so it was great fun, and so it was just being with your cousins and hanging out, and it was good fun. So I think just doing things like that on the farm was probably some of my best memories.
Mm-hmm. Can you explain to me what your job in the hospital is and what your role is?
So I'm a respiratory and sleep physiologist, which when anybody ever asks me what's my job and I tell them to go, what's that? Never heard of it. And to be honest, I hadn't actually ever heard of it until I went to university. So my role is, we are mainly like an outpatient based service, but we do deal with inpatients and respiratory. So we've got lung function tests where we try to help diagnose patients with breathing problems or exercise problems, and through a variety of different testing procedures. And then we have our sleep end of things as well, so people who have sleep problems, they come to us for diagnosis, and then we carry out their treatment and their therapy, and we monitor them over the time that they're on that therapy. So mainly dealing with patients with COPD or asthma, lung cancer, sleep apnea, things like that. So it's a very varied job, very patient focused, very rewarding, and it's something that not a lot of people know of, and patients come and they say, I never knew this existed. So people don't really know that it's there until they have to become a patient of it. So that's what we do, and we're sort of like an allied health professional. So if people think about physios and radiographers, we sort of fall under that umbrella of careers.
Yeah. What inspired you to follow this career?
Well, at school, definitely science was one of my favourite subjects, and I was good at it. So of course I decided to do law when I went to university. So it just shows you, like, I did law because I knew I would get points to get into UCD, and I you know that's sort of nearly expected of you to do something like that. And I suppose really we didn't have a lot of career guidance in school, so I made that decision based on, well, I can do that course, I can get into it. So I went to UCD and I did a first year of law, and I was like, oh my goodness, I don't fit in here at all. You're down in Dublin, and all these other people on the course, their parents are barristers and judges, and they're posh, and I'm like, oh, this is not for me at all. So like I was very quick to realise I wasn't in the right course, but I stuck out the year, and then at the end of that I was like, oh, I can't go back to that. So it was basically just made a phone call to Kerrie one day, and I was like, what course have you got? And there was this course called clinical science. Now my course isn't called that anymore, but I was like, yeah, that sounds great, let's do that. So headed off to Jordanstown, and as I say, not a clue what the course was, never mind the job, but I just knew that something in science or healthcare was what I really wanted to do, and never looked back, and was delighted with the decision I'd made. So it worked out well in the end.
What do you enjoy most about your job?
Well, the day is very varied. Like there's always something to do. There's, like I say, we've got different elements within the service and within our job. Like it's definitely like you're dealing with patients and talking to patients, and that's the best thing. You get people coming in and they've got great stories to tell you, especially the older people, you know, and at the moment maybe they haven't been out of the house in such a long time, or you know, it's the first time they've been speaking to somebody in a long time, so they really value that appointment, and you know, they've got great things to tell you. So the interaction with patients, and listen to what they have to say, and seeing the enjoyment they're getting out of their appointment, even though what they have to do, like when they come for a test, it's hard work, and you know, you're making them, you know, do a lot of difficult things, but they're really enjoying it, and they're enjoying the conversation and the communication as well. So you know, just dealing with the patients, and then you see like they've got a positive outcome, or you're helping towards their diagnosis or their treatment. So, and especially with sleep patients, you're following them the whole way through their journey, so you can see the benefit that they're getting out of their treatment, and that's really rewarding, because you know, with something so simple as a CPAP machine, which is what patients get for sleep apnea, it can literally change their lives. So you know, how could you not, you know, feel rewarded from that?
What would you say is the most rewarding part of your job?
So as I said, just like seeing the positive results for patients. You know, they've got people who they don't sleep, they're so tired, you know, when people are tired they're very cranky, and you know, you get them back in and they're completely different people. They're like, oh my goodness, I didn't realise how awful I felt. So you know, whenever they come back to you and they say, this has really made a difference to me, that's so good. And you know, you've got patients maybe who have to go for surgery, you know, they've got cancer, and then you see them back in a year and they've made a recovery, and it's like, it's so good to see you, and like they're so delighted with everything. And that, I suppose as well, like everybody is so glad of the health service now, that people really do, you know, convey that gratitude to you now, whereas before everybody was glad of it, but now everybody's just so appreciative, and it's so lovely to hear that feedback, that people really appreciate what you do. So like nowadays, like you're getting so much positive feedback from people that, you know, you feel so proud of what you do and what you're part of as well.
Yeah. Have you worked in different hospitals? If so, what was it like?
So whenever I was a student, I just did my placement in Tala Hospital in Dublin, and so like that was very different to Daisy Hill. It was a huge, big, massive hospital, I suppose a different socio-economic group of patients that you were dealing with. Like Tala would be, I'm not sure what it's like now, but back then it was quite a deprived area, so you had lots of, you know, antisocial behaviour. You had people who were very, you know, with very little, very poor health because of that as well. So but it was a really good start to my career because you learned how to deal with so many different types of people and ways of communicating with people as well. So I've only ever worked in that hospital, and then I've worked in Daisy Hill, and Daisy Hill is lovely because it's such a community hospital. Everybody in the hospital says hello to all the staff. You might know them, but you're walking in the corridor and everybody says hello. Patients, they feel so passionately about Daisy Hill, and you see it in the news and the papers. If there's anything they're saying it's bad going to happen to Daisy Hill, they fight for it. So like the sense of like a community spirit around the hospital is fantastic, and it's a lovely place to work. It really is.
Could you cast your mind back to March 2020 and the outbreak of COVID and the devastating images being broadcast throughout the world? What was your thoughts and concerns and how you were going to work through this?
I know it was. When you think of it now, it's very hard to actually remember things back in March 2020. Like that is now 2 years ago, and you were seeing Italy and Spain and China, and you were looking at people in the hospitals, and it was so frightening. Every day we'd come into work and we'd be like, I wonder, is it going to hit today? Is today the day it's going to start? And I remember being in a meeting and we were trying to plan for like how we were going to deal with this, and like there was some of the doctors saying, we're actually going to have to choose which patients we let die because we're not going to be able to save everybody. We don't have enough equipment, we don't have enough beds. We're going to have to choose who lives and who dies, and that was so frightening. This was not what you signed up for. You signed up to save people, not to choose who dies. So it was really scary, and it was just because you were watching it happen in other places in the world. You were just waiting for it. Was getting closer and closer to you. Now, thankfully, it never hit to the level that it did in the likes of Italy and Spain, but still, it was such a humongous change. Everything just stopped and just changed completely. Our jobs changed, the hospital changed, life for everybody changed. So, it was a big adjustment. So, I hope we never have to go back to that again.
How did working in your job change during COVID, and how did you find adapting to this?
So at the start, I remember just getting an email one day from my boss going, okay, everything you're doing stops and you're going to be redeployed to ICU. And I was like, ICU? Oh my goodness. Who thinks that's a good idea? But we were like, okay, right. So myself and like all my team, we were just stopping what our job was, what we were trained to do. Patients were being phoned going, your appointment's cancelled. And up to that, patients were ringing in going, I've seen COVID on the telly, I don't want to come to the hospital. So we were like, okay, we're going to go to ICU. So we were like, well, we have to go to Craigavon Hospital. So we went over to Craigavon and met up with the team from ICU, and they were like, yeah, we think that your skill set will work well in ICU because I suppose with ventilation and respiratory and all that sort of stuff that we'd fit in well. It was a baptism of fire. We were sort of associated with the ICU critical care technicians, so we were dealing with the ventilators, we were dealing with blood gases, transporting patients, proning them. This was in ICU itself was a brand new world, and through COVID and on top of that, it was just, it was surreal, but you were just in it, so you just got on with it, and somebody just said, this is how you do this, and you were like, okay, so now this is what I do, so you got on with it. But PPE became a thing, there was glass barriers up, and you were looking through perspex screens at people in the ICU. You were looking at them being brought to if they had to go for an x-ray, and like shutting off corridors and signs up everywhere like do not enter here, COVID, and it was like very scary. But I say, you're just in the middle of it, you just had to get on with it and not even really think about it. It didn't dawn on you how mad the whole thing was. So it was really enjoyable at the same time that it was a whole new skill set, a whole new set of people, and you got another set of something even more rewarding out of your job.
Mm-hmm. What impact did working during COVID have on you and your family?
Well, I suppose like everybody, like I have 3 kids at home and they weren't going to school anymore. My husband, he was a key worker as well, so we just abandoned them basically. Luckily enough, they were old enough that they could look after themselves. But yeah, we'd go off in the morning. Now my husband, he doesn't work in healthcare, so he was coming home okay. I was coming home stripping at the back door, having to shower, petrified that you were going to be bringing something into the house. There was no vaccines at this time. A lot of this is up to a point as well. You weren't even wearing PPE, so and you would go into shops, and I never experienced this, but people were saying that they were being refused to be served because they didn't want anybody in the hospital coming into the shop. So my poor kids, they just were left to fend for themselves, and you were working extra hours, so you weren't there with them as much either. You were working weekends. Like I just had a nice wee 9 to 5 Monday to Friday job, but that all changed. You'd maybe have to leave in the afternoon and not be home until night time. So, but for the kids though, at the same time, they really grew up too, because I needed them to do stuff at the house that they got away without having to do before. So they learned new skills. They learned how to use the washing machine, how to make a bit of dinner for themselves, and things like that. So, I can't say that it was too bad. Once we got over the worry of me giving everybody COVID, then it wasn't too bad.
Yeah. What is your lasting memory of having to work during COVID?
Yeah, I suppose at this point we're probably coming into a point in time where you can think back and reflect. When you're in the middle of it, it's just happening now. As I say, you're looking back and you do struggle to remember. But I suppose it's just how everybody just got on with things. At work, you did jobs you weren't trained to do. You got trained while you were doing them. So there was you learned how to do jobs, but everybody just got on with it, did what they needed to do, did what had to be done for patients to keep them safe, keep them well. So the sense of team and just working together, and everything was just for the patients. Everybody was learning, like the doctors, the ICU nurses, everybody, they were all learning as well. This was all brand new for them. COVID, how do we treat this? So just how everybody came together as a team. You had people who used to be nurses and they worked in admin or all sorts of different, and they were all just coming back to just get hands on board, do whatever could be done to get us all through it. So just seeing how well everybody just chipped in and did what needed to be done. Again, it just made you really, really proud of where you work and the people you work with.
Yeah. What advice would you give someone looking to get involved in a career in healthcare?
Well, I think, as I say, everybody who asks me what I do, they're like, I've never heard of that. So there's so many other options out there other than being a doctor or a nurse. Definitely get work experience as much as you can, because even people say, I'd love to be a physio, but everybody wants to be with Man United or with the Armagh team. That's what they want to do. They don't realise that physios actually do a multitude of other things. There's so many different types of careers out there. Getting to try as much of them, or speak to people that do those jobs as much as possible, is brilliant, because there's lots of options that you don't know about. So really researching into what is out there, and if you're interested in healthcare, there'll be something there for you, regardless of how academic you think you might be. There is a way, and there's a path into it as well.
Yeah. Outside of work, what interests and hobbies do you have?
Well, would be very involved with my kids and what they do. So they're really sporty. So I'm involved with their club. So I'm the child welfare officer for my son's soccer team. I'm the vice chair of our community games team, our community games club, and then chairperson of our ladies football team. So lots of committees, lots of things like that. Don't do a lot of sport myself anymore, unfortunately, but it's great to be involved with those. And because where I live now is not where I grew up, it has given me a way to get involved in the local community now, and it's a great way to meet people, getting involved in clubs and things like that. And then my kids, I'm making sure that there's something for my kids to do all the time now, so that the clubs are, we've got committees and people involved and volunteers and all of that. So they're not gonna not have these opportunities, not be able to play the sports that they enjoy. So basically, just being on committees is my hobby.
Thank you, Kerrie, for allowing me to have this opportunity to get an insight into your life and career as working in the hospital.
No problem, Jodie. Thank you very much.